You know what? I'm going to go ahead and start. We'll just leave that open for a little bit. That's okay. You know, I'm a firm believer of starting on time, and I know some people got late and everything. So they're asking me to sort of stay close to the microphone because we're being recorded. So just an FYI, anything that you say will and be used against you and held for a long time, you know. All right, it's very good. So, guys, thank you all for coming. I always admire the people who come to the very last sessions because they're really like either the locals or the diehards or have bad flights. So I appreciate you staying and everything. And so we're going to start out just a little bit about me. I'm an old guy suffering from the allergies right now. So the guy altering the voice here is going to have fun with that. Up until well, I started out in EMS when I was 15, and so I've been up until December of April of this year actually, April of this year. It's the first time since 1976 that I didn't have EMT something after my name. So my risk stuff is gone. I'm a former instructor. I ran the paramedic program at UMBC. I've taught with Jeff Mitchell my entire life there and everything. And so as you can see, I've been there for a lot of different things. I've been to 9/11, where I worked actually down on the ground with, I was sent up to work with the FBI guys and the NYPD fellas, and I was one of the very few mental health professionals that actually got to go out um, to the actual landfill and things. So I've got a large background there. And as of last week, I'm nationally certified EMDR therapist. So after all that training and stuff, so I'm proud of that one. So, but I'm a Roy and Johnny generation type guy. If you this is the first test. If you're going to do any work with firefighters, you've got to know who Roy and Johnny are. Anybody not? Anybody not know who Roy and Johnny are? We're all good? Okay. All right, good. So the objectives for the purpose of the foundation, what we're going to talk about today is there. You can read, okay? So disclaimer, there may be a little bad language. Got to put that in there. Um, this is not a scientific, this is not a George Everly presentation. This is a Dwightism presentation. This is the experiences that I've learned by working with fire, police, EMS, military. So I run, as after I retired last year, after 28 years at the university, I decided, well, I can do this therapy thing, which I've been doing therapy all along, but I said, I'm going to start my own business. This was in June of last year. 1 month after that, we had a line of duty death, fire death here in Howard County, Maryland. And little did I know that was going to open up the gates. And what I did not, I mean, I knew, but I didn't really know, was how few people there are out there that specialize in fire, police, and EMS. And so as soon as they found out that, ooh, somebody speaks our language, Zoom, my business went crazy. So next month is 1 year. Uh, I am completely full. I have a wait list, and I brought on 4 part-timers to handle, and I'm seeing about 70% uniformed personnel. So if you go back and you do on your website or whatever, and you tagline yourself that you work with uniformed personnel, you will stay busy. There's no doubt. I'm going to tell you some of the quirks that I found because this is essentially my practice. I want to put it in perspective, though. When we look back at the way PTSD has been and stuff, we always talk about the Vietnam War, which was talked about this morning in general session. And we see the percent of the statistics there of if you went to war, you had about a 30% chance of coming back with PTSD. But look at the numbers, look down here at firefighters in particular, of 20%. So the thing that you remember is fire, police, EMS, military, they're all war grounds. And I'm going to share a story with you a little bit later on of a client of mine who was on a fire rescue call and ended up, it was a battleground that he was in. And I can share the story with his permission. So, who are the first responders? Uniformed folks. You know, your EMS, your military, your police. And this is a really great picture for me. This is at the end of a 40-foot ladder of one of my firefighters who has severe PTSD. There's a gentleman signing right there. Severe PTSD. And the way that he ended up in my office was anxiety. Anxiety. He was so anxious that when he called, we could not get him into the office. We started our initial session in the car. It took us 15 minutes to get him into our office, worked with him a session or two, and then another time it took me an hour and a half to get him out of our office. So I have a sofa in one of our offices. It's like, look, dude, go over here, do some meditation, chill out, relax, breathe, take a nap. And he did that so that we could get him out. This shows him 4 months later, now sitting at the top of that ladder. And come on in, there you go. All right. And can you tell us your last name, please? Okay, great, thank you. So these are the accomplishments that you get, is when you get your clients able to go back to their job. I got a message from him the other day while I was here. He is now ready to go back to work and he started shift again. This is a long process. Unlike a lot of therapies, yes, we can knock down trauma, pretty quick, but getting them back to the workplace is very slow sometimes. I'm really sorry you can't see this, because this is a great cartoon. But these guys are really different. They have this dark humor. So here are the firefighters, this guy, of course, is burned up in his house, and they're roasting hot dogs, okay? So, it is just what it is, But we do have dark humor. And for us, it's a coping mechanism, right? Because we see the worst of the worst. And I do a lecture on wellness. And so I'm up in front, I'm in Salt Lake City. So I talk about dark humor, and I give some examples of it. And I said, let me just give you an example of the dark humor, okay? So you just got to work with me, folks. So I said, you guys remember Kurt Cobain, right? He was the musician, he shot himself, killed himself. What color were Kurt Cobain's eyes? His eyes were blue. One blew this way, one blew that way. Well, this whole group, 1,500, they're just roaring, laughing, And it's like, you guys are sick. Why would you laugh at that? Well, it's the way we cope, right? It's not being disrespectful, But, we can clean out a restaurant pretty quick, okay? I got a curiosity. Why is it that you want to do this type of work? I mean, there's a lot of, quote unquote, easier jobs in therapy. What draws you to this population?
I've been there.
You've been there because of your history, right? So your background again was military?
Military and law enforcement.
Military and law enforcement, right? You give me your little, this guy's doing it back here, man. He's about a veteran.
Yeah. I run a nonprofit that we do mental health and peer support, sort of in the virtual world, people reaching out to us. And I need a network of culturally competent therapists that I can refer people to.
Great, good. And you got a long history of chaplaincy and all kinds of stuff.
I'm a chaplain, and I occasionally have to deal with people.
Okay, job injuries. You're a therapist also. Okay.
My sister's an ICU nurse.
Mm-hmm.
She's a cop.
Right. Right. And it's an interesting thing that you mentioned, nursing and police and fire. We find each other, right? We find each other, and that's how we sort of get through, okay? So I'll pick on you guys a little bit later on there. So, but you're seeing this common theme. We want to do it because we have experience in doing it. We have friends who do it. But I'm going to tell you some of the quirks. One of my colleagues who calls herself a trauma therapist, okay, identifies as a trauma therapist, came to me and says, I don't know how you do this job. I can only take 5 of them maximum in my practice. I said, 5? She said, how many do you see? I said, well, right now, I see 38 clients a week. 70% of them wear a uniform. And they said, well, how do you do it? Well, first of all, you have to deal with some anger management issues, of course, with them. But what I find it's very helpful for me is I think because I'm so busy, I do my 50-minute session. It gives me 10 minutes to reset my brain, potty break, welcome in the next client. So I don't think I personally have time to absorb the trauma that I hear. And for me, that's a very good coping skill. That also says, though, I'm a firm believer that every good therapist has to have a therapist. So, I've just recently started seeing someone, and I think that you need a therapist that's going to call you on your own stuff. You know, if you just sit there and you got a head nodding therapist, probably not going to help you very much. You need somebody that's going to be a little aggressive. So, you know, that I think is also important as we go along. The work is obviously not for everybody. So these are things I've learned so far. Crises don't wait for your office hours. My friend, who the other one who said I can only do 5 of it, when we were talking, she says, well, I don't do Friday, Saturdays, or Sundays. You're not going to do this business, right? Okay, because crises come at all times. Crises come in the middle of the night. That's when they sometimes need you. You need to be prepared for the F-bomb. And I mean every shape, form, and size of it. And it's really interesting because in my introductory comments, and we're getting to know each other, I tell them, I said, it's okay to drop the F-bomb in here. And you'll just see this relief because it's just part of their culture. And so the F-bomb flies a lot. I have a client I've been picking. I mean, he's got the MF bomb and the F-bomb combo. And it's like I said, it's my goal by the time you leave therapy to go an entire session without one time. And of course he said, yeah, good effing luck. That was his response. And it's like, okay, I have been challenged now. So it's pretty good. You got to alter your treatment philosophies. You know, if you are strictly a cognitive behavioralist, you're going to have to alter it. If you're a DBT therapist, you're going to have to alter it. I'm going to check that door, please. Okay. And you just got to have everything in your bucket. That's really what I think you get from coming to this conference, is you're learning about a little bit about wellness, a little bit about mindfulness, you know, and different types of therapy. Park your feelings at the door. You're going to be abandoned. You're going to be cursed. You're going to find tremendous emotion in what's going on with it. So you got to park those feelings sometimes and recognize you're going to hear about the worst of the worst. These people's worst days are going to be when you ask about what's going on, okay? Some people are not comfortable with having guns in their office. I do not take my guns from my police officers. They're naked. They're absolutely naked. So I get used to guns in my office. It's perfectly okay. I have no problems with that. Now, some therapists will have a metal lockbox, so they can put a lockbox in their office and the police will park it. But I personally, I'm okay with it, okay? So I love this picture, as you see. It says, asking an EMS medic about what's the worst thing they've ever seen. Okay? It's like saying, relive, for me, your worst nightmare, the images that you can't get out of your head, the things that changes the person that you are. And oftentimes, they don't realize that it's there. People always ask me, because I've got 40 years of EMS experience, what's the worst thing you ever had? I can very easily pick it out, and I can tell you. I was on a helicopter. I lived in Louisiana for 9 years. I was assigned to fly out to an oil rig for a helicopter crash, 13 dead burned bodies. I was stuck out there because the fog came in. We're rescuing we're recovering the burned bodies. The next day, I finally get to go home. The entire mission was about 36 hours long. I thought I was okay. This was December 22nd, 1989. About 15 years later, I'm over here at the great Johns Hopkins. I'm getting my eyes burned to get my laser treatment done on my eyes. And I am laying there on that table, and the little red light's going around, and the smell of burned tissue came over my nose. And I started getting antsy and sweaty. And they're, of course, going, hold still, Mr. Polk, hold still, Mr. Polk. And he got done. He says, what's wrong? I said, I am in the Gulf of Mexico. It took that long. I had no idea. So needless to say, a little therapy after that, you know, with 20/20 vision. But I got it done, you know. That was scary. And then the doctor said, you know, well, we usually don't tell people about the burn smell. I said, you might want to do that. You know, it's sort of important, right? Now, go back to your ICSM stuff, or your CISM stuff. The terrible 10 that we see, line of duty death, that is something that I've been working with a lot here in Maryland. We just had a firefighter die, line of duty death in July of last year, and it has opened up a lot. This is an agency that has never had a line of duty death. They had a sticker on the back of all their engines and their trucks that said everyone goes home. And all of a sudden they found out that not everyone goes home. In this case, it did not. So they had the trauma of the death, the situation around the death. That was in July. Several days later, they go back to the station and there's someone else sitting in his seat because the job goes on, right? The job has to go on. And for many of them, the line of duty death brought them back to their own mortality. And I've been working a lot with clients exploring their own mortality. The fact that, gosh, you're a number, and that's a big break in the fire service. And so I've been doing a lot with that. Line of duty deaths are the worst. They're just the worst. Because they keep on going. We have memorials. We have fundraisers. So now we are coming up on a year. The internal review report is coming out. We're waiting for the NIOSH report to come out. That's another 3-4 months. So from the time of a line of duty death, it might be 18 months until people finally get settled down. And so it's really tough. Suicide, serious injuries of a worker, events that threaten our lives, getting guns pulled on us. The drug situation right now, I have a client who had 12 drug overdoses in one shift. That gets to be a lot. In the DC metro area, they have K2 and PCP, which of course they become very violent and they get assaulted all the time. Of course, the kid deaths are always a struggle. I'll tell you a story on this one maybe a little bit. Prolonged events that go on for 2, 3, 4 days, especially if at the end everyone is still dead. Serious events that have media killing and stuff of innocent people. So we have the Big 10, right? So that's where we start. Now you'll notice outside of this is anything dealing with a personal life. Marriage problems, divorce, death of their own child, spouse that comes down with cancer, infidelity, divorces, death of a parent, and death of the family pet. Let's talk about that in a second. All right. So here's my buddy again, up the end of his ladder truck. First thing you gotta do, if you're going into this business, you gotta learn some alphabet soup. So military guys, they have their alphabet soup. Police officers have their alphabet soup. This is just a very quick one, just in the fire service. You need to know the difference between a truck, an engine, a ladder, a wagon, okay? Each one has a different meaning. Understand chain of command. In that chain of command, who is a union member, who is not a union member? Are they part of the administrative process or not? Or SOPs, what's a VA? Of course, it's your breathing apparatus. But they use these terms, and you're supposed to know what they mean. What's the RIT team? The RIT team is the Rapid Intervention Team, so that in the case of a fire, they have what's called 2 in and 2 out. 2 firefighters go in, and for every 2 firefighters that go in, there's supposed to be 2 firefighters outside to rescue them. That's the Rapid Response Team, or your RIT team. And that played a big part in the death of our colleagues here in Howard County, was the role of that RIT team, okay? So that's just part of it. And here's the trick. You can go on Google, Google has everything. Google firefighter terms, and a whole big list has come up. Police terms, whole big list comes up. So you can educate yourself very easily with Dr. Google, okay? So this is an interesting concept. We've all talked and we're all heard at some point in time about the brotherhood and the sisterhood of the police department, the brotherhood and the sisterhood of the Marine Corps, the fire department. Everybody's got a brotherhood and a sisterhood. So it's interesting. Part of the hood is belonging to a union. That makes you part of a collective. You belong to the IAFF, the International Association of Firefighters, or the IAFC, International Association of Fire Chiefs, and law enforcement, help me, FOP, thank you. There you go, got that one. So that's part of it. That makes you part of the group. concept of we got your back. There's a caveat to the got your back. It doesn't always happen, okay? So, for example, we got your back until you do something wrong. We got your back until someone dies, or we got your back until you run a red light and you crash your ambulance, and now all of a sudden it becomes political, it becomes administrative. So we find out brotherhood and sisterhood is not always true, with one caveat that I'm learning. I'll talk at the very end about the IAFF Center of Excellence for PTSD and Recovery. If people heard about it, some of you maybe not. The IAFF has created, believe it or not, here in Maryland, we're so fortunate, an organization or it's a treatment program. It's intensive outpatient or intensive inpatient. 28 days, 2 months. The record is 93 days. And it is for dual diagnoses. It can be drug, substance use, alcohol, and PTSD. I have about 15 clients who have gotten out of the center. And they come and tell me, and one of the first things is that I learned what real brotherhood meant, because now they belong to a subset of people with PTSD. They share their stories, and there's this new brotherhood that has developed over the last 2 years of the Center of Excellence. I personally am a big fan of the Center of Excellence. There's lots of other treatment programs out there. As you've heard this week, people have talked about them. But that's really the biggie. Now, this is the fun part. So why are they coming to see you? Well, first of all, if they come and tell you that, well, I'm coming because I want to, I would look with skepticism, okay? Because maybe they are, but there's more than likely, it's the spouse wants them to, a brother or sister or a chaplain. In this case, I'm not talking about blood brother, I'm talking about sisterhood, brotherhood. EAP referral, which automatically, in the eyes of uniformed personnel, they don't trust EAPs because they think that you're going to report back to the EAP, which is going to affect their job. That's not true. You make your notes very brief and non-specific. The agency ordered them. Never a good reason to have anybody in your office, right? You have been ordered to go to counseling, all right? Not good. So this would be your classic administrative referral, maybe from like an EAP. This is what I'm finding out. Crap got bad. When crap gets bad, they will talk to a brother who will say, you know, why don't you go talk to John? John's a good guy. I've been to John. You've been to John. You go to a counselor? And that's how the word of mouth is going to be your advertisement, okay? Sometimes it's between you and suicide. That's choices you got. I'm going to kill myself, or I'm going to talk to somebody. Recommendation to union rep, I find is good. Now, from the counseling, beware of clear for duty. I need you to clear me for duty. No, don't do this. I said, I will work with your psychiatrist, and I will work with the county mental health person or for the agency, but I alone will not give a fit for duty. Okay, that's a toughie. Okay. My favorite story: spouse wants him to come, so Brian gives me permission to tell his story. Brian is you're not supposed to have your favorite clients. Brian's one of my favorite clients. He is a good referral source for me. Brian comes to me. He has 12 years of military experience. He went to Egypt during the time when there was the presidential uproar that was going on in Egypt. So he's there. He is a Marine Corps medic. All right. So he's there doing his Marine Corps medic thing. He also has a little volunteer fire stuff going on. He gets back from 12 years in Egypt, and he is now an 8-year firefighter at one of the local agencies. So he has a bad pediatric call on the ambulance. Thinks that triggers it. His wife brings him in, literally at taser point, because she's a cop. Imagine that, paramedic marrying a cop, right? How's that? All right, so she brings him in literally taser, and the exact words out of her mouth is, fix him. Fix him. I said, so what's going on with him? He's been having nightmares for 7 years. Fix him. Okay. She told me, she said, I almost had to tase him. His nightmares were so violent that she was almost getting hurt. So we sit down, we start talking. He tells me about his experience of this bad pediatric EMS call, and he tells me about when he was in Egypt as a medic over there. He's laid back, he's chill, and they come screaming for him, we need you out front, we need you out front. He goes running out, and one of the local Egyptian ladies throws a child into his arm who's burned from pulling hot water down on top of her, scalded. So he's struggling with this. He doesn't know anything about kids. He is a Army adult medic. So he starts taking care of the kid. He calls for a helicopter, and the U.S. Army refuses to send a chopper because it's not a U.S. citizen, it's a local. So now that adds to his stress. So he throws the child into the back of the truck. They go driving through the deserts of Egypt. They get word there's a truck with 2 people coming at you. And he just looked at the person and said, we might not live, we might die. So turns out it was part of the military, it was all good. So they were coming to help out. So I get him in, and the second time I meet with him, I just said, start telling me more about this Paul, this pediatric kid. Next thing you know, I look over, and Brian is soaking wet, head to belt line, soaking wet. He dissociates, and it's like I can tell he's not there. I said, Brian, where are you at right now? And he says, I'm in Egypt. I said, okay, so what's going on right now? He said, the smell. I can smell the desert, these kids, I said, okay, we've not talked about any treatment. We are on day 2. I said, Brian, do you trust me? And he went, yeah. I said, okay, good. So I moved in, and there's a special type of EMDR where you do called ATIP, and it's strictly visual, nothing with emotions. I did some very quick eye movements. Tell me what number it is. 10. Good. A little bit more. What number is it? It's an 8. Do a little bit more. What number is it? It's a 3, 2, a 1. He dries off. He looks up and he goes, I'm back. And good. Great. Okay, so we talked a little bit more. He's not had a nightmare in 8 months. 8 months. 5 minutes of eye movement. Now, of course, we've done some more since then. 8 months, he's not had a nightmare. This is the stuff that when the spouse brings them in, you're in trouble. You've got something big going on. So be prepared for that, okay? All right. Why else are they coming? Stress, and more stress. Anxiety and depression. Pediatric calls, line of duty deaths, mass casualties. Death of family members or pets. Notice this one. 3 clients have walked into my office. I have PTSD. I need you to help me. Okay, great. So we start talking. One of them happened to be involving our line of duty death. We got a glimpse of the guy's face as they were resuscitating him. So we're in the process. I do some EMDR, some eye movement with him. Next thing you know, we're back 2 years prior to his father in hospice. And I said, what are you seeing right now? He said, I'm seeing my father's eyes. Okay, good. Let's go with that. Did some more EMDR. We're back 4 months prior to when he had to carry the family German Shepherd into the veterinarian to be put down. And I said, where were you when they put the dog to sleep? He said, I was holding his head. I was holding his head. That was the problem. It wasn't the line of duty death that triggered him. It was the death of the family dog. So if you've never really worked much with this clientele, what they come into you with is not where you end up very often. It's wonderful from that standpoint of the work. Officer-involved shootings, administrative actions, suspensions, light duty. There's no 2 words that people in a uniform hate more than light duty. Because these are type A, action-oriented. I like being outside, playing with hoses and guns and stuff. Oh, you're going to go sit in this cubicle and you're going to push papers for a long time. And they go bonkers, bonkers in there. Workers' compensation. And then sometimes I have now discovered the trapping between work and retirement. It's called the pension. They get stuck in a pension system. And if they is everybody familiar with the term drop? The drop or not? A drop, okay. A drop is when an organization says, okay, what's your first name? Okay, Jasim? Jasim, okay. Tell me about, you're looking to retire in the next 2 or 3 years. What we're going to do is we're going to give you $100,000 a year. And we're going to plan for you to retire in year 2022. And we're going to give you the 300. That way we know when you're going to retire and you're done. It's called the drop. Okay? Big money for people. Some of these drops can be 300,000, 400,000. Then they're in the pension system. I got to make it 20 years to get my pension, 25 years to get my pension, plus 3 years in the drop. They come into your office. How long you been working? 17 years. How you feeling right now? I hate my job. I hate people. But I got to make it to 25 years, and I'm going to really work to 28 because I want to get the 3-year drop. Now they're trapped. Because many of the pension systems work that if you leave, it's not like you're taking your 401k with you. You're leaving most of that behind you. And so they feel very trapped. And boy, am I dealing with that a lot in my office right now. Okay. You seeing it also? All the time. I think we need to be advocating for the pension systems to change to maybe a 50% pension system, 50% 401k type, so that there is a way out, you know? But what's changed? The world. This is not your grandfather's fire department. This is not your grandfather's law enforcement. Back 25 years ago, people love police officers. Walk over here in Baltimore City on East Baltimore and see what they like about you. Zero. Okay? So the pension system concept is an old concept that needs to be changed. And I think it may be up to us to be able to provide some feedback for that. Right, exactly. Well, and the thing is, what happens when they retire? We're going to take all your blue uniform shirts and your blue t-shirts and we put them over here. Oh, done. You have no clothes in your closet anymore. They lose their identity. So retirement for this population is horrific. Many of them will stay in the system, especially police officers. They will stay in the system so long that they are actually paying to work for the county government because of the way the system's set up. Because, you know, they don't have an identity. Or I always joke is your marriage is so bad that you don't want to stay home, you know, and I mean that in a joking way, you know. So there's problems. Other things they come in with, complaints. I can't sleep. From my personal experience, my Dwightism, that's your number one problem. If you have a client who cannot sleep, that's where you start. Because if you can't get them sleeping, you can twitch your eyes until your arm falls off because they're not getting REM sleep. They got to get REM sleep to process trauma. So my first goal is identify an issue or two, and I very quickly, I do some eye movement stuff and I do some trauma therapy with them to get them sleeping. Melatonin. If we need to, we do a psychiatric referral to get them on some trazodone. Or if they're having nightmares, they take Prozocin. Okay, Prozocin. It's also Minipress. That suppresses the nightmares. Once I get them sleeping, then I can do some work with them. Okay. Nightmares, intrusions, flashbacks, nightmares, night terrors. Again, the Prozocin works really well for nightmares. Depression, anxiety, marital distress, domestic violence, infidelity. So when we're talking about marital distress and infidelity, divorce rates among uniformed personnel, roughly 75%. It is a job hazard. So you have a 1 or a 3 out of 4 chance that your marriage is going to end up broken. Okay? The infidelity, was described to me by a Johns Hopkins psychologist, a colleague of mine. He said, why is it that cops cheat so much? He referred, and I broadened it. He says, it's very simple. He says, you're a paramedic, right? Yeah, I'm a paramedic. Okay, good. Tell me what you do all day on the paramedic, when you run as a paramedic. Well, we save lives every day. No. Tell me what you do. Well, we get dispatched, we go out to a person's home, we provide care, and we take them out. No, tell me what you do. So he wanted me to tell him. I arrive on the scene. I introduce myself. I ask the patient what's wrong. I need you to hold still and take a breath for me. Lift up your shirt for me. Follow my fingers as I, check your pupils. Hold still. I need to check your pulse. Move to the stretcher. He says, so you spend your entire day telling people what to do, right? Yeah, pretty much. What do you do when you get home? I see where you're going with your spouse, right? We tend to take that stuff home with us, right? So we tend to tell our kids what to do. We tend to tell our spouses what to do. So what happens when your marriage starts having problems because you're gone 24 hours at a time, you're irritable or whatever? Well, things are sort of out of control, right? He says, what's one thing a paramedic, fireman, a cop has to have? Control. So the way they get control is they cheat. I can get on an app, I can go looking for an app, I can find somebody, I can start a conversation, I can make the arrangements, I can go have the little infidelity, and I have control in my life for a short period of time, and then I go back. And I went, that's a pretty good theory. And I ran it by one of my police officers, and he went, yeah, that hits me. Married for 6 months, he's had 2 affairs already. And that was it. It's like, wow, pretty powerful. It's one theory, Again, no research here, absolute Dwight issues, okay? Anger issues, especially in men. One of the first signs you see in an undiagnosed depression is anger. So if they come in angry, go looking for depression. Start there, it's a good place to go. Substance abuse, alcohol, painkillers, sleeping pills. They are the biggies. Nicotine, and a few others we're going to talk about that might surprise you. They withdraw. They start having psychosomatic complaints, body aches, back pain, discomfort, suicidal ideation, suicidal attempts. Okay, so sometimes you have to make a hard call. Okay. This was told to me by a police officer. He said it was told in the academy that if I needed emotions, they would issue them to me. And they carry that into the field. You need emotions, we'll give them to you in the academy. Other than that, you don't need emotions. It goes back to what I heard somebody say this morning, suck it up, buttercup. Those days are over. Those days have changed a lot. I love this here. No amount of guilt can change the past. No amount of worrying can change the future. Many of them feel guilty. Many of them worry. Anxiety issues. Worry and anxiety are all there. They worry about how they're going to keep doing their job. How am I going to make it to 25 years? How's my relationship? They worry about the sun coming up, the sun going down. They worry, but they don't like to tell you that they worry. So using some diagnostic tools that you might pull offline, therapyaid.com has some really good tools that you can download. Okay, so I think that's it. Some challenges. I've got 7 slides of challenges that I've discovered, and there's more, and I'm sure you guys can add to them. Please do. The stigma. I'm not going to a shrink. I'm not going to a therapist. I don't trust anybody, especially a shrink. I'm not going to tell you my personal stuff, so they don't trust us, but the stigma. I had a call from Brian, my client, the other day while I was here. He says, I got one of my buddies I need you to see. Brian. Swamped. What you got? He says he was only line of duty death, and he's got this intrusion. He hasn't slept in months and everything. And he just happened to talk to me. He said, why don't you go see somebody? I'm not going to see some shrink. Brian said, well, I do. You do? I've been going for months. And as soon as Brian told him that, it gave him permission to do so. So that becomes a bond with them. I love what we do with CISM. I love what we do with our wellness education. It's all good stuff. But if I really want to get you to go, I need you to help you tell her it's okay to go. Then they'll come. All right? Maybe they need to come with them. I've had other firefighters bring a buddy to therapy. I'll wait for you out here. And after that first time, it's all good. Okay? Suck it up, buttercup mentality. They feel weak, they feel shame, they feel embarrassment. If you are not talking about embarrassment in your sessions with them, please do. They will talk about it once you bring it up. But they're embarrassed about being there. They're embarrassed about feeling the way they do. Providers don't cry. First aid or an orientation. I said, look to your left. What do you see there? Box of tissues. Look over here on this table. On your right, what do you see? Box of tissues. Why do you think they're there? I said, you in this room, you have permission to cry. And then I tell them, my words for it is, crying is your body trying to simply wash your soul. Let's wash out the dirty stuff. And boy, when you hit the right spot, they do cry. And it's wonderful. Soldiers becoming first responders. You know, they leave the military, go into the police organization, they leave the military and become firefighter paramedics. They continue it because it's the mentality. It's another band of brothers I can join. I just trade out my uniforms, different uniforms. Denial and excuses. If anybody goes down to the center of excellence, the word that they use down there all the time, it's just an excuse. Just another excuse. You're just making excuses. Now, what's going on? No, that's an excuse. And that is a term you need to use. Do not particularly be soft, warm, and fuzzy. Call them out. No, that's just another excuse you're giving me, okay? So that worked well. Here's the bad stuff. What am I to work on first? You know, how do you take a 28-year career of stuff and figure out, well, what are we going to talk about first? Ask them. What's the big ugly one you want to talk about today? Tell you what, here's a great homework assignment. Why don't you go home and write down the top 6 things that you want to talk about while we're in session. In talking about the top 6, you want to bet we get down to the next 6 or 10 or 12? Absolutely, right? Presenting cause, symptom, something else in the closet. You are going to hear them talk about, I put stuff in the closet, and they store the closet. And I said, you know why you're here today? Because your closet's full. And somebody opened the door of your closet, and your boxes fell out. And now it's just running around like a little bunch of rats trying to find a hole. We're going to help you clean out your closet and make room for more stuff. Emotions are very deep, very buried. You got to go after them. Confidentiality is a big thing. I have to look at my schedule, and I have to alternate making sure that I schedule different departments so they don't run into each other. And actually, one county contacted us, say, are you seeing too many of our employees? How can you keep confidentiality? And I explained to them, but so here locally, I'll put in Howard County, I'll do an Anne Arundel County, I'll do a civilian, then I'll do a cop, then I'll do a state trooper, and so I alternate them. So at least I'm getting a little variety. But what I'm finding is so interesting when I do multi-jurisdictional, County A all complains about the same stuff. County B's issues, all about the same stuff, the same people. I know these organizations, which have hundreds of people. I know about 4 from every organization. Lieutenant this, Captain this. Everybody around here is going through trauma right now because everybody's got a new chief. All new chiefs around the area this last year. So people are all upset. Fear of dying in their own mortality. This has popped up a lot. Facing their own death. I have a client who's very, very afraid of dying. And I was going to try the experiment with him about, why don't you go home and do me a favor? Why don't you write your obituary for me? And bring it back and we'll talk about it in session. What would you like people to say when they read your obituary? His exact words, hell no. And I said, okay, we're not going to go there. we'll save that little exercise, okay? What are you going to do it? Claustrophobia. This is an interesting one that's popped up because of the line of duty death that we had. Now, the report's not out, so I don't have any data, nothing official, but there was a very big concern about our recent line of duty death was, did he burn up? We don't know. Did he suffocate? We don't know. Was there a mass failure? We don't know. But what it translated to for them through the rumor mill was, we think he suffocated. We think there was a problem with his VA. And I have guys coming in now. I've had 3 clients come in with acute claustrophobia. And these are veterans, 18-year veterans, 20-year veterans. One, I'm saying, I've always been a little claustrophobic, but this did it. And then what happened was the organization started doing training on Mayday calls. And they've created the environment in which he died, and they're panicking, and they're having panic attacks. So you're going to need to learn how to deal with claustrophobia. And it's really interesting. It's very neat. The comorbid issues that come in: closet full of stuff, marital strife, substance abuse, infidelity, divorce, depression, suicidal ideation, financial issues. Now, with this psychosocial family thing I presented, multiple marriages. I have several who have 3 marriages, several that's on their 4th marriage. What comes with that? Alimony, child support, and lawyer fees. One guy's got $90,000 worth of lawyer's fees. How do you do that on a fireman's salary? Well, the answer is he works constantly, right? So part of what I've had to do was to work with him to help him get some financial help and reorganize so he can get his life back, okay? Feeling you're being broken or out of control. Okay? I have a great line. I stole it. I can't remember where I stole it from, but I make it sound like it's mine. We have a conversation about us. Do you feel broken? So when you come in here, coming to see a therapist, do you feel broken? Yeah, I really do. I said, you're not. You're not broken. You're affected. You have been affected by bad stuff that you have seen. You have been affected by financial problems. You've been affected by things in your marriage. You're not broken. We're going to take care of you. We're going to tape you up. We're going to let things heal, and we're going to get you back out. You're not broken. You're affected. That change in vernacular really is helpful. It's very powerful for them. And that way we can talk through those issues. Now, here comes the hard part for some therapists. These are not private pay folks. If you run a private pay organization where you do not take insurance, you really aren't going to be able to do this work. Because most people's private pay, $125, $150, $175 an hour, they can't afford it, right? I've already just talked about money. They can't afford it. They're not going to pay out-of-pocket rates because most of them have one of 2 or 3 insurances. Aetna, Cigna, or United, all of which pay $65 or $70 an hour. So if your charge is $150 an hour or $175 an hour, they're going to get $65 back. They can't do that. Blue Cross pays $101.93. Okay, they can sort of do that if you would do a sliding scale, but they don't have it to put out. They have kids, whatever. Are you willing to take EAP clients? Okay, like Cigna EAP refers some of their clients to me through the fire service. Workers' comp. I love workers' comp fireman cases, police cases. I love them all the way to the bank. Because here in the state of Maryland, they pay your fee. So if I take an insurance claim with Cigna at $65, I can take a workers' comp claim and get $175, which is my hourly charge. So you've got to be willing to work with these. And of course, what comes with workers' comp? Paperwork. Okay, so you've got to be willing to do that. I don't charge for paperwork. I know many clients, many therapists do. It's me giving them back something. I don't charge for paperwork. It's just my dedication, giving something back. That's just me. Gender bias from within the department. Gender bias as a therapist. Guys will not oftentimes come and talk to a female therapist. Women oftentimes want to talk to a female therapist. So there's gender bias sometimes in this. So be ready for that. Along that same line of gender bias, just give you a great story. Sad, but great story. I have a client who came to me first time. We went through the whole session. He says, I think this one's going to work. I said, well, what happened the last time? Well, my EAP sent me to this little lady. I'm sure she was a very good therapist, but she's a little gray-haired lady. I'm sure she's very good. Halfway through the intake, she got up, started crying, ran out the door going, I can't do this. I can't do this. So, what did I just tell you as my client? You're really screwed up, right? Okay. So, he came in my office, he dropped the F-bomb a couple times. We're good, okay? I keep things in my office. I have bottles of water in my office. I got bowls of candy. And I make it, I said, I want you to feel like it's home. You want some candy? Get up and get some candy. I keep snack bars. You hungry? Get a snack bar, okay? And it helps them to relax, you know? And it's really, really it's just something I do. They are addicted. They have addictive personalities. Pornography. Pornography, pornography, pornography. Because they have problems with their marriage. So they, and they go in both directions. Sex addictions, gambling, a little bit of shopping. I have an Amazon.com addict. I got a smack this year. Now, back to our abuse of drugs. Nicotine, smoking, and dipping is a biggie. CBD oils. Now, in the state of Maryland, CBD is allowed, but not in most fire services, police services are not. But most of them have a very little bit of THC in them, so they're taking chances because it helps with their anxiety. They swear by it. They absolutely say it is the best thing. And so it's like, okay, these are your risks, you take those chances. Most of them, of course, as you well know, have ADHD. So in the dictionary, it's their pictures and everything. So they're on Adderalls and Ritalins and Focalins and Vyvanse. Then they go on sleep aids so they can get to sleep. I don't like candy. I keep them away from them. I like melatonin. Melatonin is a very good sleep app or a sleep medication and a meditation app on your cell phone. I like Calm. There's multiple ones out there. I use Calm myself because obviously I'm one of these guys. My brain doesn't shut down. And, Matthew McConaughey reads me a bedtime story at night and off I go to sleep. And it's wonderful. So, there's some really good meditation, relaxation apps that help with this. Caffeine, I have one gentleman that drinks 4 pots of coffee a day. He sits in my chair and he's as calm as you and I. Can you imagine what his withdrawal would be like? 4 pots a day. Testosterone. This has been identified down at the Center of Excellence. Many of them take testosterone supplements. One, machismo. Size, they lift weights, they need the machismo. Many of them take it because of the fact that they think that it boost their energy, stuff like that. But there's a slide I'm going to read you about testosterone in just a moment or two. Sleep habits, their sleep hygiene is horrible. Shift work. A lot of the organizations, still do the 2 14 days, 2 10-hour nights, 4 days off. Think what that does to your body. Or they work 24 on, 48 off, 24 on, 72 off, up all night, get home, sleep the first day, sleep cycle off, so the circadian rhythms are really off a lot. I had a report I read a couple months ago that because of the stress and because of the sleep habits, the life expectancy of a corrections officer after they retire is 8 years. 8 years. So it affects your body. This stuff. They have not OCD, but they have OCPD, obsessive compulsive personality disorder. It's not that I'm going to sit there and turn the lights on and off 7 times before I leave, but I'd be sitting there and I would be going. So they go around and they correct everything. They put stuff, the way that they want to see it. Where does that happen? At home. Screaming at their kids, screaming at their spouses and stuff. We see that a lot. So you gotta be aware of that. They binge eat, they have aches and pains, so they have the psychosomatic problems. They don't like taking psychotropic drugs. They're gonna fight you on that big time. You need to get them to understand why they need to do it. So you need to get, I use a hand balance thing. I say, okay, this is normal, like this. And down here is where your serotonin and your norepinephrine, your dopamine levels are when you're stressed. And down here is when you can't think very clearly. So all I'm doing is just asking you to bring your levels up here so that, you can start thinking clearly. And it's, you might be on this for maybe just 6 or 7 months, but we got to get you reboot. Just consider it a Control-Alt-Delete, okay? And to help reboot yourself. And they buy that, okay? And at that time, you need to have a list of referrals sitting right next to you. I need you to see this person. And you need to work with a psychiatrist or a mental health nurse practitioner that you trust who understands your clientele, all right? Now, this is a biggie. They want to know, what's my diagnoses? They oftentimes, depending on the state, they will not let you give them a diagnosis of PTSD. For some states, if you have a PTSD diagnosis, you cannot own a gun. And so they block you from owning a gun. So you might have to put down adjustment disorder. That's always a safe one, okay? Acute stress disorders, mild depression, whatever it is, but some of them don't like that. Unless they're going for workers' comp, then they're going to like that one. Now, I oftentimes will put initial diagnoses, adjustment disorder with depression, will continue evaluating for PTSD. And I just put that in my notes. So it's the documentation. But this is it, just a couple things, my mind never sleeps. Sleeping is hard when your mind's full of thoughts. Your mind can stop thinking so much at night. I need some sleep. Guilty. Okay, that's me. All right. Now this is not in the pack that was in your folder, but or on the app. I added this one, OCPD, long family histories. They got long family histories, both from problems, substance abuse, alcoholism, divorce. I would not even want to put the number of clients that I see that have divorced parents or alcoholic parents. And I'm guessing, is that pretty uniform of everybody that in here? Childhood trauma. Yep, they come to it. So we're going to talk about the ACEs in just a moment. I have multiple clients who come in and say, I do not want to grow up to be like my father. And boy, you know what? That's a great therapeutic tool. Because when they start denying, well, I don't want to do this, or I don't want to do this, I said, but you know what's going to happen if you don't get some help, if you don't do some changes? You're going to end up like your dad. And then it usually drops the F-bomb again. And then they change for you, okay? So just get used to it. Yeah, this is so me. This is my household. I'm not OCPD, but you can count on me to turn the toilet paper in the right direction. There is a correct direction. You know that? Really? Over or under? It's over. That's it. Exactly right. The patent picture is toilet paper over. It's okay, Michelle. Oh my God, yes. Yeah. The cats do. That's right. That's right. Now, if you do have cats, you do have to put it under, because that way they can't unroll it. Look what you got to learn from. You came to this whole conference to learn about which way toilet paper goes. So what are their coping mechanisms? Denial. That's just the way they do it. There's nothing wrong with me. I'm fine. And we know what fine in therapy language means, right? effed up, ignorant, neurotic, and egotistical. Okay? All right. Alcohol has been brought up. What is it's a team sport. When these people get together, days off. It's around alcohol. The St. Baldrige thing just was a couple weeks ago where they shaved their heads and stuff for cancer. It's always at a bar. You know, alcohol is an integral part of the uniform service. Lots of sex, no sex. Okay, shut down, go for it. Pornography, infidelity, more alcohol. Just a reminder. Painkillers, and this is often starts just simply because of an injury. A sprained back or a sprained knee is oftentimes the starting point of addiction. Okay, gallows humor. We talked about the boxes in the closet. They cope by isolating. Man caves. My one guy, this guy is, talk about a success story. He came to me, and if anybody's chin could get any closer to the ground and still walk, you know, he would be a dog. And depressed, flat affect, just a do-nothing attitude. And so I worked with him for about 6 weeks, and I said, you know, we're not making much progress, are we? I don't think so. I said, you know why? No. I said, because I don't have the skill set to get you better. I said, you and I talked about this. And I said, I reached over and I picked up my phone and I said, you need to call the center and we have to get you into the center. Think on it for a minute. So we sat there for just a couple minutes. He said, okay, make the call. It's on my speed dial. I call the center, get them down in Florida, you know, and Richard, Dwight in Baltimore. How bad I know him. I know the name. Richard, Dwight in Baltimore. I have a client in my office that we're looking at to come to the center and do an interview right now. Yep. We do the phone interview. He takes his information and he gets his, he said, okay, I'm going to send you some information. I'm going to check your insurance. I'll get back in touch with you. I get off the phone and you can see this weight. He says, that's it. I said, yep, it's time. So he goes off to the center. He's at the center for 5 weeks. Comes home to his fourth wife. And the problem they're having now is she doesn't know him. In the 15 years they've been married, she's never seen him without PTSD. He smiles. They go out to dinner together. He goes outside and he works in the yard. He has come out of his man cave. And it's created family stress. I have several of them like that. And one thing about when they get better, when they come out of these centers with this big change, it changes the family dynamic. And the spouses have trouble adapting. I've got one like that right now. She's gotten out of the center. She's got a 180. This is a really different one. The husband's struggling. He is just struggling because it's not her. She's this new, bubbly, wonderful, and she's doing great. Now, he's the problem. He's also a firefighter, and her word to him is, you know you need to go too, right? It's like, oh boy, here this goes. They call him sick. They use a lot of sick time. A lot of sick time, okay? All right, you can just read that one to yourself. Now, have we all not felt that way at times, right? I don't get paid enough for this, right? We've all felt that way. We've all hit burnout at some point in time. All right? Good. Okay. So there are drugs of choice. Alcohol, as I said, is part of the culture. They use marijuana and CBD oil for sleep and anxiety. Cocaine is still big. Stimulants for ADHD and work overtime. A lot of overtime. Chronic pain and opioids. Testosterone we talked about. People can be of codependency. They're very codependent on their spouses, are very codependent on their brothers. Okay? I always watch out for this one right here. This is a biggie. If they are, quote unquote, addicted to their brothers at the station and addicted to overtime, I want to know, first of all, is it financial, or is it that's a problem of a sign of a bad marriage? That's a biggie for me. Not wanting to go home for something other than just strictly financial is a sign of a bad marriage or a problem marriage, okay? Go down that path, challenge them on it, okay? And find out, okay? So I got this from Dr. Morris down at the center. So this is Dr. Morris's quote. They come to her and they complain, I'm so tired, all right? So as you can read here, it's about low testosterone, while sometimes the culprit of fatigue probably gets more blame than it deserves, low T. There's a great deal of variation in normal testosterone levels. We often see firefighters that take way too much testosterone attempting to treat their fatigue and their low sex drive. They don't realize that higher than normal levels have significant adverse effects, include stroke, high blood pressure, increased risk for prostate cancer, mood issues, including anxiety and anger outbursts. Just what they don't need in a treatment facility is somebody with anger and mood outbursts, right? Okay? So that's one of the things that they evaluate and they treat them for. And she says, I don't have a problem getting people off alcohol. I can do that. They don't want to give up their testosterone because they think it's going to make them less of a man. Okay? Now, and I say that, because the majority of clients who go to the center are men, but they also do see a fair amount of females there. Okay? All right. So you got to get used to having a gun sitting in your office. I have a state trooper who comes in, and if I was an artist, I would draw him as a rectangle. He comes in and he is square because he's a big dude anyway, and then you put body armor and guns and belts, and he can barely fit in a chair. And it's like, I feel very safe actually, But during the intake, I told him right up front, I need you to be truthful with me. Don't lie. I told him right front, don't even try to lie. And the way I said, I have a bullshit flag and I will throw it. But I share it with you. If you think I'm telling you something that you don't agree with, you throw it back. I said, it makes me a better therapist and gets you more involved. And tells me that you're paying attention. And so I call him out right now. You got it, tell me the truth. It takes extra time to build trust with this place. Okay? Long time. You should be running aggression inventories, anxiety inventories, and ACEs. I'm going to show you ACEs on the next slide. Just be part of your intake packet. Send it home with them as a homework assignment. Tell you what, each week I'm going to send you home with a new test to do. Bring it back. See where it's at. And it gives you something at the end of it to show them how much improvement they've made. They may be impaired. Fatigue. I had a guy come in, and 20 minutes into session, he was falling asleep. I went, dude, just want a nap? I said, I need to. He said, good. Just curl up, just take a nap for a minute, I'll wake you up in 10 minutes. So I turned around, I started doing some work, 10 minutes, I woke him up, and we continued. He was so exhausted. But a 10-minute power nap worked for him, okay? And it was okay. I have two clients that I let them dip in session. I am not a dipper. I don't like tobacco products. I said, as long as you don't drool it on my carpet. Because for them, what is it? Why do they want to dip? What's going on in their bodies? Anxiety. And it calms them down. That tells me, and I can always tell at what point David gets to the point where we're getting ready to hit a hard issue. Now he has his empty bottle sitting there. But when I'm getting to a hot spot, I just reach in and he'll load up. I know I'm in the warm zone. For me, it tells me where I'm at. And it corrects me. If I'm not getting him dipping into the session, I go a different path. Because I know him very well. May require detox before you really get treatment. So you sometimes have to go for treatment. Make sure you have a good treatment regimen, available to you. Okay? So my intakes are pretty interesting. So here's the ACEs story. If you don't use this, you can Google this. Exactly what I did. It looks for this childhood experience, adverse childhood experience, screaming parents. They ever touch and fondle you? You ever feel that no one loved you? And basically it comes down, there's 2, 4, 6, 10 categories of this. You have a family member went to prison, you have somebody who's depressed, mentally ill. So it comes down to that if you have 4 or more ACEs, 3 times of lung disease, 11 times the chance of drug abuse, probably 4 times the chance that you had intercourse by the time you were age 15, all of this. And then it equates right here to your childhood stuff, your disrupted neurodevelopment, adoption of health risk behaviors, stuff like this. So it's a great tool. And so all my clients do that. That's one of their things, is an ACEs evaluation. Because it really gives you an idea of what's going on. Neglect, childhood stuff. It's right there, oftentimes it. I have a client who's a 9-year-old slept with a knife in his bed because his father was a drunk. And I don't mean that disrespectful, that's his words. My old man was a drunk, and I slept with a knife. Because he used to like to come in and beat me. And then you can imagine what came words after that. Think as a 9-year-old sleeping with a knife for your own safety. So what do? Become helpers. I'm going to help people. It fits. When you look at that. So they have some pretty rough stories. Yes, ma'am.
So you send that with them? So you do that on the intake?
I send them over. I send ACEs out after the end of the first meeting. Or, well, that's not always true. I have my 3 inventories. I have my anxiety, my depression, my ACEs. And depending on what I'm feeling from them, I might, over the next 6 weeks, I will eventually get them out. But I don't hand them all 3. They go home and do these for me, because they'll never come back. I often have to wait till the 3rd session before I even start doing it. So every client's different, but somewhere in the first 6 sections, I like to get a good feel. Sometimes we'll just do it in session. I'll do ACEs in session. So I'll tell you what, I was going to send it home. Let's do it now. Just tell me what you got. Boom, boom, boom.
Look right there. Is that, because I know
Google. Google images, ACEs. Dr. Google has everything. I do suicide risk. If I have a client who comes to me fairly acute, every session, intake, and then until I feel comfortable. So at least one question is that, okay, honesty time, where are you at today on the suicide? I use the one things, the pediatric smiley face ones and stuff. They actually work really well for firemen, where are you at today? Okay, you're a straight line face. Yeah. Effective treatment modalities, there's so many of them out there right now. We always start sometimes with our CISM models, but if you go through CBT, DBT, of course, these are understanding, why. Why is it that you're doing what you're doing? Education. Dialectable is looking at their negative beliefs about themselves. Emotional freedom and the thought field therapy are the toppers. Doing energy psychology stuff. I took through the TFT one the other day. I think it's going to be a really good tool for them to take home with them. If I can teach them, okay, you've got anxiety, I need you to, tap here, to go home with this, okay? I think that's where I'm going to probably use that more. One of the presenters yesterday, I think it was, made the comment about exposure, the repetitive exposure therapy, and how his view was it creates more trauma sometimes. It can escalate their traumas and stuff sometimes. So I'm not an exposure therapist, but I guess in a way I do that with EMDR. So that's something that we use. And there's the TIR stuff and all your trauma-informed therapies. I personally, I'm an EMDR guy. I love twitching eyes. There's multiple levels of it, depending on how far we want to go into the body and the emotions. This ATIP thing, first of all, is everyone at least somewhat familiar with EMDR? So everybody got it a little bit? So the basic concept is when you got severe trauma, the center part of your brain that connects your left and right doesn't work very well. And so you help make these neural connections by getting their eyes moving, sort of like REM sleep. There's a new technique out called ATIP. They're a couple of years old. It's very cool. It is strictly right here. It's the one I used with you. 10, 9, 8, quick 4-minute, 5-minute type stuff just to de-escalate the image. They can go home and sleep. They're looking at teaching this to firefighters and police officers to use on scene. You arrive as an officer, you get there, you've got 3 people shot, there's blood and guts all over the wall, and you look over and you see an officer and he's sort of standing by his car like that. John goes over and he goes, Joe, what's going on, man? That's awful. He says, you seeing it? Yeah. Come on, walk with me for a few minutes. And around the corner, how you feel? Give me a number. Give me a number. Give me a number. And they're rolling this out. There's a couple places in North Carolina that's doing this now. They're teaching the police, and what it's doing is they're hopefully preventing them from developing PTSD. Now, the good thing is it doesn't erase it. It's not hypnosis, so it's not screwing with the law enforcement part. That's right, because it's only this part. It's not here, it's not down here, it's not down here or here. So it's just getting it so it doesn't develop into PTSD. It's so freaking cool. Yes. Flash is this new technique. We can all do flash together, okay? So this is something that comes out of 2 researchers from California. So basically what I'm going to ask you to do in a moment is ask each of you to think of some image that bothers you. Now, nothing, I don't want a 10. I just want like a 2, okay? So like a 2 image, you know. Somebody brought you a raw cheeseburger. Well, I'll go for lunch like they did mine, okay? But the whole concept is basically this, is as I want you to each sort of back yourself up a little bit so you got a little bit of room. All right, so I'm going to have you in a moment. I'm going to have you alternate, clap your legs. And when I say flash, I want you to take your eyes and go. Blink your eyes 3 times. Okay? Make sense? So picture whatever little image you've got. I'd like everybody right now to have that image that you got of whatever's bad. I want you to start clapping with me. When I yell flash, blink your eyes. Flash. 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 And that's it. Now, that's a very short quickie. Did you feel any reduction of the symptoms a little bit? It needs a little bit more. So it's a little bit more training with it, a little more prep with it, a little bit longer, but it's also a nice technique. If you learn it, you can sit through this painful 6-hour thing online. But basically what it is, it's sort of like an EMDR thing with this click, click, click with your eyes, and it helps to desensitize. And you can send them home with that. You know, they can do that. I have a guy that I just for EMDR, I have him do this. He went to his workers' comp hearing and found that he was getting himself nervous because he had to testify. So just sitting under the table before he got ready to testify, he was doing this. So he testified his workers' comp. The lawyer said, okay, what were you doing under the table? And he says, that's something my therapist taught me. And it got him through. So it's any of this bilateral stuff. That's what flash technique is. This is the other thing I like. Blunt, direct talk. Not how you feel about that. I don't feel. But you gotta have some emotion. Well, I'm pissed off. I'm pissed off all the time. You want an emotion? There you got one. And that's where it goes. So you just need to ask them. It's like, you know, maybe your empathetic response is, you know, frankly, I probably would have wanted to strangle somebody too. And that's exactly it, you know. Or you call them on their BS. You throw the red flag, okay? And they're okay with that. I actually have found that most of my clients are very responsive to that. You know, they don't like touchy-feely. These aren't touchy-feely people. I love this, okay? This is Steve Barry, my good friend. You know who we haven't heard from yet? John. Well, John's got his walls built, right? Okay, so that's John. So you can see that a lot. Okay. So, this is a Dwightism. In my opinion, you need to have EMDR to really do first responders. They need something that can fix them a little bit quick, get them back out, bring them back in a little bit more quick. You know, they don't have 14 weeks to come in every week and go, it's talk a little bit more. They need the onion peeled real quick. Okay. I'm going to work on the TFT. I'll let you know in 2 years. Okay. Medications. Now, everybody here probably should be familiar with most of these. But I'm finding that with PTSD and our EMS folks and our firefighters and our cops, they're not using some of the traditional drugs for traditional things. Lamictal, of course, would be normally what, bipolar, right? Mood stabilizer. They're using it for depression sometimes. I have a woman who is very resistant to SSRIs. She gets horribly sick. So what they end up doing? They're putting her on Abilify. She's doing Abilify for depression. Of course, that's an antipsychotic. It's wonderful. She's doing great. And they're actually talking about putting her on the injectables so she's going to get once a month and not have to deal with it. If you're going to do anything with these folks, learn about propranolol for anxiety. Propranolol is a beta blocker. It's not a Thorazine, it's not a benzo, it's a heart beta blocker. It tells the heart you are not going to speed up, you're not going to beat too fast, you're not going to have too many breaths. Calm down before it ever gets started. And it's a PRN. They can take it up to 3 times a day. And they love it. Doesn't make them groggy like a benzo would. It's a really good one. A lot of people are on gabapentin also, okay? Which we're seeing that one come back a little bit more. There's some old drugs popping up. Sleep, I talked about melatonin, prazosin, and trazodone. And of course, I forgot to put focal in here also, okay? But ADHD meds. So they come out with a lot of meds. Referrals. You need to have a good list of referrals here. Now, let's go a little bit deep. Dr. Morris shared this. Substance use programs, inpatient, outpatient, things like that. So I know we have some substance use. Sleep studies. They may need a sleep study because they have sleep problems, poor sleep hygiene. Many of them happen to have a little too much here, and so they have some extra weight. You've ever been to a fire station at nighttime? You have CPAPs over here. Everybody's on CPAP, and then the non-snorers are over here. And even when you go down to the Center of Excellence, they have cabins. So they have put all the snorers in one cabin. They put all the people with CPAPs in one cabin, because a lot of them are on CPAP for sleep studies or sleep problems. Sexual disorder clinics. We're very fortunate here in Baltimore. We have a Johns Hopkins doc who specializes in sexual disorders. You might want to see if you have one somewhere that you can refer to in your area. Nutritionist is very good. Have a good nutritionist that can work with them on their diet and making sure they're keeping themselves healthy. Endocrinologists, especially for those who are sort of worried about their manhood and stuff, so the testosterone and everything, get them over and get that evaluated. Okay, it's a good one. Psychiatrist or a mental health nurse practitioner. Here in Maryland, our mental health nurse practitioners are fully licensed without a physician guidance. And my God, if it wouldn't be for Tamika, who is the one I sent to, she had no idea that she was going to become a specialist in fire departments. And when I first started sending clients to her, you could get an appointment in 2 weeks, and now I can get them in 6. She's really busy. That's over at Gladstone in Columbia. Oh, she's great. She's wonderful. The center, of course, there's lots of other treatment facilities. Consideration of a comfort dog of some kind, I think, is a good referral source for some of these folks. So look at those. This is just part of the Center of Excellence. They have variations. You have to go through detox first if you go in for substances before you move into the PTSD section. They do individual, they do group therapies and stuff. And again, I get nothing from these folks. Except I send them clients, they send me clients, and it's good. And you get clients from also. Yeah, they're great. They do good work. So, parting thoughts. Challenging little group to work with. Hard, but tremendously rewarding. I love it. I'm working harder now than I ever worked in my life, but it's good. It's a good thing. So any questions or anything? And again, this is not a research one. This is a You guys work a lot with me. Any comments? Anybody else comments? Things that would help others here?
If somebody's working in law enforcement, and then we have the Harrisburg, really
What's that one about?
emotional survival for law enforcement.
Okay.
And I actually, I don't know if non-law enforcement people all the time, but especially for officers who that and he'll do it as well as for spouses. It's an emotional survival for law enforcement. And it really goes through and explains things like physiological stuff that
Mhm.
happens and why that affects peacefulness and how you work. You know, and it's like, well, this is what happened. And you just like,
Mhm.
deal with it.
That's great.
You
Yeah.
have to read the whole thing. You can just go on. Everybody
Mhm.
The other thing I was gonna say with EMDR, I had cops that they won't necessarily tell somebody that they went to see a shrink,
Mm-hmm.
but they'll say, you know, I had that EMDR stuff after my shooting, and, you know, I can do it for that. So that doesn't seem to.
Right. Now, one thing I would say also with EMDR, if you have a police officer or somebody who comes to you with an active case, like an active shooter situation or something that's real fresh, you do need to verify that you're allowed to see them. The sad part of it is there are some agencies that, I'm sorry, you're going to suffer because until we get everything documented well, you can't see anyone. So that is a problem sometimes. Good point, yeah. But what's nice thing about the ATIP is I don't go into the emotional part where I back it so far back that I can't remember. I just get to sleep, you know. So, got a question or a comment? Mm-hmm. Nah, I mix them all up. Fire, police, EMS, military, you got a uniform. They're all genetically the same. We're all screwed up, you know.
You know, they think they're very different from each other, but it's very similar.
Yeah, you're just,
Similar, you just.
that's right. It's exactly right. No, absolutely, because, and so much of it is, you know, and I find it very helpful to sort of generically share stories. You know, I mean, I don't violate anybody's confidentiality, but I will say, you know, I've got another client who, it just, hey, you're not the only one who feels like this, you know? Yes, ma'am.
I had found, because I do a lot of work with military,
Mm-hmm. Yeah. Right. Yeah, and let me speak on that real quick. Again, I use this again. You know, spouse sends him, fix him, right? Okay, so I use this model. Okay, this is where the marriage should be, right? Okay, it should be here. You're down here, at least in your wife's eyes. So down here, she's looking at you down like this. She's looking down at you. So you come to get fixed. We're fixing you. We're fixing you. We're continuing to fix you. Now you're better. But since she sent you to be fixed, that was an assumption there was nothing else wrong with her. Now, guess what? You're up here looking down at her. So after a certain point, I say, like, you really need to get your wife to go see her own therapist because, you know, you're a tough guy to live with. You know, I joke with him. I said, can you imagine living with you? She needs to go get some help also. And because that is exactly what happens. And that's what happened with my one client. She went to the center and she went from here to here, and he is not happy. He actually sort of implied, I wish you were like the old person again. Think of
Like
that.
what happens with substance abuse.
Yeah, exactly. There's a codependency thing going on. Yeah, it's such a cool
Yeah,
one.
you get better.
That's right, because I don't want to get better because this is what I am, so you need to be at my level. Yeah. Yeah. Boy, haven't we all. And that the amazing thing is it doesn't matter what part of the country we're from, it's all the same. So hopefully you got some things out here to help you a little bit. Great. Thank you so much, guys. Safe travels going home, everyone. Huh? Oh, a coat. I do. Yeah, there you go. There you go. Oh, and look at this picture. This is not like the best picture. The first time I ever saw a therapy dog was at 9/11. I was down on the pile. And that was the beginning of therapy dogs really being used. I was down on the pile, and there's a fireman sitting there. He's got his helmet off, and he's rubbing this dog. And someone said, you know, you're getting ready to see something special. And I just watched it, and he got up, and he put his helmet on, he stood up, and you could see the tears that had run down through the dust. And I'll tell you, it still brings chills up to me. That changed me right there. So I knew I saw something special. So, all right, safe travels, enjoy your general session tonight. And you guys be careful going home wherever it is. Anybody did not get a card that would like one? I've got them up here.